Amoxicillin, ampiclox, tetracycline. They are such a mouthful, but I'm sure you know what these drugs are. Now, anytime we misuse these antibiotics, we actually give them a chance. We actually give bacteria a chance to learn how to fight them. Misuse today only means resistance tomorrow. Welcome to Health Matters, your number one guide to health and wellness. I am Amanda Imosibue. From a study in 2024, it showed that out of 12 developing countries, Nigeria has the third highest percentage of antibiotic prescriptions at 48%. Now, another study that surveyed 400 students showed that 67% of them, which is roughly 268 students, reported fair antibiotic usage practices, 26.5% had poor practices, with only 6.5% having good practice, with the most frequently used antibiotics amoxicillin, ampiclox, and tetracycline, often used for conditions like typhoid, cough, and catarrh. Now, joining us to unpack the misuse of antibiotics is Dr. Ohisi Geleke. He's a community pharmacist, currently the superintendent pharmacist at Visco Virello Pharmacy in Benin City. Welcome to the show, Dr. Ohis.
Thank you very much. Thank you very much for this opportunity. I really, really appreciate it. Thank you so much, Amanda.
Okay, so let's dive in quickly. Now, what is the aim of
Yeah.
antibiotics in the body?
All right. So, before I answer that question, let me explain what microorganisms are. So, microorganisms are really, really small living creatures. Yeah, we can't really see them with our normal eyes. We have to use a microscope. So, these creatures are found almost everywhere. They are ubiquitous in nature. They are found everywhere. So, the common ones are bacteria, viruses, fungi, and your antibiotics, their major job is to kill these bacteria. It's either they kill them or they stop the growth of this bacteria. So when a person is infected with this bacteria, that is when the person is supposed to take your antibiotics. When you're infected with, okay, let me put it this way, there are some good bacteria, there are some bad bacteria. The good bacteria are found naturally in our system. So just hold on to this information now. You would need it later on. So when a bad bacteria in quotes infects a person, the person takes antibiotics so that the antibiotics would kill this bacteria and the person becomes better. So yes, that's the major job for antibiotics in the system.
Not that we're trying to give anyone ideas, but enlighten us. How can we actually differentiate between bacterial infection and viral infection?
Okay. Bacterial infection are localized at the first stage. That's the major difference. Bacterial infections are localized, so you can see bacterial infection of the throat, bacterial infection of the eyes, urinary tract infections, that is bacterial infections of the urinary tract, and bacterial infection of the ear. But when it comes to viruses, it is more systemic. By systemic, I mean it affects the blood and it goes like viruses affect your DNA generally. So it goes everywhere. It's systemic. You see more systemic symptoms such as muscle aches, headaches, fevers. So these are more systemic symptoms. So that's the difference between a viral and a bacterial infection. But majorly, to be on the safe side and to be very, very sure, what we do is that we advise the patient to go to a registered laboratory and do a test. Registered laboratory and do a test. You can complain of your symptoms to the doctor there or the lab scientist there, and they take a sample, usually the blood sample or whatsoever, and they can use it to run a test. So this test would do a differential for us, telling us if it's a bacterial infection or if it's a um, viral infection. But sometimes when, let's say, due to overcrowding in the laboratory centers or lack of personnel, your symptoms alone can tell your healthcare professional or your healthcare provider if it's a bacterial infection or a viral infection. But majorly, it's just like that. Bacteria is localized, while viruses are more systemic. So I really hope this explains the differences to us.
I do get the difference. I do get it, yes. So let's go back to the main topic now. Why is the misuse of antibiotics a growing concern?
resistance, resistance, resistance. Fine, there are other small, no, I'm not calling small things. There are other issues why the misuse of antibiotics, well, there are other problems that the misuse of antibiotics can cause. But majorly, what we've been preaching to people is resistance. So resistance basically means that in a layman's term, your antibiotics stops killing the bacteria that it could kill before, because now the bacteria has grown some protective measures to protect it from the antibiotics. So there are different mechanisms for a bacteria to resist an antibiotic. It could be okay, let's say there's a site, let's say site A on the bacteria where the antibiotics could bind and elicit its effects, probably by killing the bacteria or by stopping the growth of the bacteria. So some bacteria can be so smart, very, very smart. They just undergo some morphological changes. They undergo some changes in their body. And that site A just, let's say it disappears or it's not as functional as it used to. So the antibiotics can no longer bind to it. Or the bacteria can just grow a stronger surface, like its body in quotes becomes stronger, preventing the penetration of the antibiotics into it. And some other bacteria can do it in a way that the antibiotics will penetrate, but it increases the excretion of these antibiotics. So it can enter, but as it's entering, it is coming out faster. So some bacteria can be very, very smart, and they can just create these resistant mechanisms. So when these and more mechanisms are created, it leads to resistance, and the antibiotics that usually works before doesn't work anymore on this bacteria. So this is why we are preaching these things, because I've been at the pharmacy since the morning, and I think I've met like 3 people that just came to ask for Ampiclox. I tend to talk to them like, okay, counsel them that what are you using these Ampiclox for? And some of them can be very stubborn. They would not even want to listen. So they'll just walk out and say they're going to get somewhere else. But we try to tell them that resistance can happen, and treating resistance is not cheap. It's not cheap. So it's that we avoid the abuse of antibiotics now than to face the financial burden later.
Okay. So hear me out. In a way, it just seems like, um, bacteria and AI, they're similar. Hear me out. Because, people say, oh, when you keep feeding AI information, it's going to conquer the world. But we understand, like, when you keep feeding them information, in a way, they get to, like, sometimes when I text, like, oh, I'm like, write it in my own humor. And then because I have fed AI so much information, it's writing it in my own humor. And out. Same thing with
Okay.
bacteria. When you keep feeding it with antibiotics, it just grows smarter and it begins to, like, dodge. Do you understand my point? But
Yeah, I
now,
do.
what are the most common ways that people misuse antibiotics?
Just like I said earlier, you need to do a test to know if it's a bacterial infection. So some most people they can just come. I think one problem we have is the ease of accessibility. There are a lot of unregistered chemists, or not use pharmacists, because for a pharmacy you need to be registered. There are a lot of unregistered chemists, and these people just have access to some medications. I still do not know how they do it. So they have access to some medications, and Nigerians can just walk into the pharmacy, into the chemist, and get anything that they want, including antibiotics, and they just take it for whatsoever reasons. And you see some cases where some chemist owners would just like mix like 3 or 5 antibiotics together in a sachet and give them, and they'll go and take it. So people, they just take this thing anyhow. They take it for diseases that are not of bacterial origin. You see people taking antibiotics for cold, for catarrh, for cough. Fine, some cough can be as a result of a bacterial infection, but your common cold is not a bacterial infection, it's a viral infection. So taking antibiotics for it is wrong. And some people use antibiotics for their livestock. Like, fine, you can have some bacterial infection for the livestock, but some of them just do it like it's a routine. They get tetracycline, open it, and give it to their livestock, fowls, cows. Yeah, so we've had a lot of cases of people even taking some antibiotics during pregnancy when there is nothing actually wrong with the mother or the child. So they will just take it and we'll start seeing issues with the baby after the baby is born. So there are a lot of ways where people just misuse antibiotics. You shouldn't take antibiotics unless you are sure that it's a bacterial infection, unless you've talked to a healthcare professional, unless you've done a test. You shouldn't use your antibiotics. We've even seen cases where people use their antibiotics to prevent. Antibiotics are not preventive medicine. We call that prophylaxis in pharmacy. Antibiotics are not preventive medicine. They don't prevent. So they treat and they cure. So they do not prevent. So okay, I've had cases of, okay, let me give you an example. During my IT, we had a patient who she was on a period and she wanted to have sex with her partner. And she was like, she wants to take Ampiclox to prevent her and her partner from getting infected. So it doesn't really work. It doesn't work that way at all. So I had to counsel and advise her that, okay, this isn't how you should do it. This is not how it should go. So people use antibiotics for the weirdest of reasons. For the weirdest of reasons. So it's not, I don't, there are a lot of things I wanted to say, but because of time, I think I can just stop here right now.
Okay, so walk me through a thought process now. Um, People buy antibiotics. Now, if they decide to say, okay, I want to treat cold, I want to treat flu with antibiotics, it's because they are probably seeing, let's say there's a change. Now, cold and flu, they're viral infections, right? So
Yes, they
if
are.
they're taking antibiotics and then they're seeing a change, explain, like, why should we not use these anti, because if I'm seeing improvement, then why should we not use antibiotics to treat cold and flu, which are viral infections?
Okay. It's just the same way you say a person takes metronidazole and tetracycline for diarrhea and the diarrhea stops, right? Okay, some conditions are self-limiting. By self-limiting, I mean they go by themselves. They just stay in the body for like 2 days, 3 days, and they go by themselves. Cold, flu, diarrhea, and a host of others are self-limiting. So you can attest to you can attest to this that there sometimes you had cold and kata and you did not even take anything and left by itself, right? Same thing with diarrhea. You had diarrhea and probably the only thing you took was Gary, or you just even prevented yourself from eating throughout that period and it stopped by itself. It's because it is self-limiting. Self-limiting means self-limiting diseases are diseases that go on their own. So most times when a person takes antibiotics for cold and flu and it stops, they think it's the actual antibiotics that worked, but it's just the disease is running its course. It has started, it has grown, now it has died, and it has left your system. So it is self-limiting. It is not the antibiotics that work. The antibiotics do not do anything. People should not give antibiotics the glory that it did not deserve. So yes, it is self-limiting. It's not just some viral diseases are self-limiting, some are not. But for cold, to be specific, it is self-limiting. Just put yourself in a good environment, take your vitamins, warm yourself up, and you see that it will stop by itself.
So, now we have been talking about the misuse of antibiotics. What danger does it pose to an individual and then public health generally? So, individuals and public health, what are the dangers?
Let's start with individuals. Or okay, let me talk then. I think we'll just figure it out along the line. Okay, antibiotics are when you do not use them properly, it can cause resistance. I've explained resistance before. It causes resistance. That's the major cause. Then also some antibiotics, they have some terrible, terrible side effects. Some terrible side effects. There's this antibiotics called gentamicin. A lot of people use it anyhow. It's even an injection. So a lot of people use it anyhow. I'm sorry. A lot of people use it anyhow. And it can cause kidney failure. It can cause kidney damage. Do you understand? It can cause kidney damage. It damages the kidney. And Even your metronidazole, your flagyl, it's not safe during pregnancy. It's not safe in children. Unless, let's say, we've tried other antibiotics and they did not work. Now you now measure the risk-benefit ratio. You find out that, okay, the benefits outweighs the risk. So let us use this antibiotic. So you should have seen some children or some people, they have this brown colored teeth. Sometimes it's not just brown, sometimes it's like very, very yellowish. Sometimes it's like a mixture of brown and yellow. It's as a result of mothers who actually consumed tetracycline during pregnancy. So there was no reason, there was no bacterial infection, nothing, nothing. The parents just felt like, okay, let's consume tetracycline. It causes permanent discoloration of your teeth. So there are several side effects that can happen. So one that we do not even talk about that much is that antibiotics abuse can even increase the chance of bleeding. Okay, let's put it like this. Vitamin K helps to your injuries to clot. So it's when you have an injury, your body releases vitamin K. It helps to heal the injury faster. Then let's say after a very short time, the bleeding stops. Yeah. So you have some natural bacteria in your GIT tract, your GIT rather, your gastrointestinal tract, that is from your mouth to your anus and everything. So some of them, most of them produce vitamin K. I don't know if you understand, most of them produce vitamin K. So when you just abuse antibiotics anyhow, your the antibiotics will kill both the infecting bacteria and the natural bacteria, the normal flora in your body. So when it kills those normal flora, you find out that your body is not producing enough vitamin K that it is supposed to produce. So when vitamin K is not adequately produced and there is an injury, it takes a longer time to heal. Now we're just saying, now I'm just emphasizing on smaller injuries. So what happens if the person has an accident or something really bigger? So the person can just be bleeding and bleeding and bleeding, unless they have to rush the person to the hospital where they have to give injectable vitamin K. Hope you are seeing the link. And this resistance also is transmissible. It's transmissible by birth. A mother that is resistant to a certain number of antibiotics gets pregnant, she transmits it to her child. Her child that does not know anything in this world now is suffering because of the mother's issues. So this thing in the long run, it affects the total public because we will now have a lot of people resistant to antibiotics in the society. So people are not getting better through treatments. We have a higher number of sick people compared to because when these antibiotics do not work, there are some small diseases there are some small bacterial diseases like your not so strong antibiotics can work. You see people dying. We have like a higher mortality rate. You see people dying quicker because they are resistant to the basic antibiotics. So this affects the public. It affects us globally because it can lead to a higher death rate. I don't know if you get. So at the same time, too, it affects people who do not dispose antibiotics properly. It affects our environment too, brings up more resistant bugs for plants and everything. So it's a very, very big problem that we do not talk much about, or rather, we've been talking about it, but people are not heeding to what we are saying. People are not heeding to what we are saying. That's basically why I even came to this platform because I believe it has a broader reach and can reach to other people that I cannot reach out to. So it affects both the public, it affects the individuals, it affects everything, Amanda, actually.
Okay. So you have really gone in depth on how antibiotics, like some things that didn't a lot of us didn't have an idea of, like, a mother then
Mhm.
giving birth to a child that becomes resistant just because she has misused antibiotics. We have talked so much about
Yeah.
that. So now
Mhm.
still on the misuse of antibiotics, can it lead
Okay.
to chronic illness and some organ damages? And if so, which of them exactly?
Okay. Definitely. Definitely, yes, definitely. I talked about gentamicin earlier on. It causes kidney damage. You see a person has a urinary tract infection, the person would not do a test, the person would not do consult a specialist. Next thing, they'll come to the pharmacy, give me gentamicin, give me five. And we tend to ask, like, do you know what gentamicin is? Do you know how this thing can damage your kidneys? Gentamicin can damage your kidneys. Ciprofloxacin. Yes, ciprofloxacin that everybody is using for typhoid up and down. Like they never even do any accurate test for typhoid fever. Fine, typhoid fever is a bacterial infection, yes. But before you can say you have typhoid fever, you should do an actual test for it. So people will come and say, they have malaria, typhoid. I'm like, which one is malaria? There's nothing like malaria, typhoid. It's not one thing, malaria and typhoid. So they will just ask for Cipro. Ciprofloxacin can actually make you crippled because it affects the tendons. It affects the tendons. The tendons helps our bones and our muscles to connect to each other. So it affects the tendons and it can damage it to the extent that you would not even be able to work again. I know someone that this has happened to. Ciprofloxacin that is everywhere. Ciprofloxacin can even kill your baby as you are pregnant and you are taking ciprofloxacin. So there are a lot of damages that antibiotics can cause. So there's this chloramphenicol. Yeah, you should have heard of that. The one it's in eye drops, it's in capsules also. Chloramphenicol can cause what we call gray baby syndrome. That affects how the baby looks. And it's also a very common antibiotic. So there are a lot. Tetracycline affects your bone development, affects calcium in your body, affects your teeth. Yeah, it affects your teeth, makes it very, very scattered and discolors your teeth, especially when it's used in children. So when it's used in children, it does those to their body. It even has issues with your growth. It has issues with your growth. So these are just few examples of some antibiotics that actually have terrible effects on the body.
So from our discussion, I've seen that
Okay.
I don't know if it's just me, but I've seen that easy like access to this drug, to antibiotics, it's a huge problem. Because I know like there are some drugs that you cannot even purchase from a pharmacy because they'll tell you you must need a doctor's prescription. But that is very, I think at this point, it's very valid for antibiotics because if it's causing, these long effects and it
Okay.
can has the possibility of increasing mortality rate, then that should be noted in a pharmacy. There should be a discussion, an open discussion about it. But now apart from like
Okay.
public education, which is everyone educate public, it's cliche but it's important, it's very important. But now do you think, like back to my point, do you think like a ban on it or maybe a doctor's prescription before sale of antibiotic is necessary?
Yeah, Amanda, to answer your question, based on ease of access, there are two types of medications. We have over-the-counter medications, the ones we call OTCs, then prescription medications, the ones we call POMs. So, antibiotics are actually POMs, prescription-only medications. So you actually need a prescription to get an antibiotic. You need a prescription to get an antibiotic. You need a prescription from a doctor to get an antibiotic. So it is not something you're supposed to just walk in and get. It's not something you're supposed to just walk in and get. You need a doctor's prescription to get it. Well, Nigeria is Nigeria. People can just do whatever they want to do. People can just do whatever they want to do. And it has grown so deep into our country that people do not even people do not even know that you need a prescription to get your antibiotics. It's just the same way you need a prescription for your sleeping pills or a prescription for your medication for hypertension. You also need a prescription for your antibiotics because we know how terrible this thing can be. We know how terrible this thing can be. So you need a prescription for it. Well, It's funny that we aren't really following it like that. Yes, even me sometimes I've even messed up earlier on, but it's something we're trying to preach to people that you need prescriptions for it. So yes, you need a prescription for it, not just anyhow, but very few people actually follow it.
Thank you very much. So, from our
Thank
your
you.
conversation is so the conversation is so in depth and self-explanatory. Now, first of all, I think like as health professionals, there should be stronger. There's obviously like a union of pharmacy. There's a pharmacy association. So I feel like as professionals, it should be really enforced. There should be a strict prescription law. And from our conversation, I understand that if we continue to misuse antibiotics, there is going to be an antibiotic resistance. It seems far fetched, but then we're facing like a future, like you explained, where simple infections become very untreatable. And as simple as antibiotics seems, it's from the conversation, I'm already having chills because there are so many things that are involved with, the misuse of antibiotics. Thank you so much, Dr. Igeleke Ohis, for your time. Thank you so much.
Thank you so much. Thank you so much. I hope I've been able to answer some of your
Of
questions.
of course, definitely. Thank you so much.
Thank you very much. Thank you so much. Have a wonderful day, Amanda.
All right, you too. I want to say a whole lot about this, but a whole lot has been said. Do
Okay.
not self-medicate on
Okay.
antibiotics. There are so many effects. Do not prescribe your drugs, but do not prescribe antibiotics by yourself. Because we have heard there are so many effects, it could lead to increased mortality and so on. I do not need to reiterate what has already been said. But this is Amanda Imosibuwe saying no to self medication and drug abuse. Remember to stay safe, stay healthy, and keep watching BBTV.